These are the voices of resilience, of courage, of families who refuse to let a diagnosis define them.
Hi, my name is Heather Nicholson, and I have Addison's disease. Before my diagnosis, I was 18 and 19 years old. At that time, I had a variety of symptoms: weight loss, nausea, vomiting, fainting. On November 1st, 1998, I was diagnosed with Addison's disease. During that time, I had been undiagnosed for over a year. I was running back and forth to emergency, and I was surviving on sodium and glucose. At that time, I was a fitness instructor, losing lots of weight and not really thinking anything was wrong with me. I knew I had a problem when I was drinking liters of Coca-Cola after fitness classes, lying on the floor, dizziness, and unconscious at times, fainting, sometimes with nobody around. On November 1st, I went into the hospital, and the doctor had told me that he was going to do one more test before putting me under exploratory surgery. The test came back positive with Addison's disease. My family didn't know what Addison's disease was, and neither did I. Adjusting to Addison's disease continues to be a lifelong struggle for me. Everyday stresses, going to work, having a baby, death, grief, moving, traveling, eating in different restaurants, all have had an impact on my life with Addison's. Everyday stresses that people have and take for granted increase my stress and have an impact on my overall health and wellness. My ongoing triggers and health challenges are constant diagnosis of new things. I realize now that I have PTSD from many years of misdiagnosis. I'm also aware that I've been diagnosed with celiac disease, which makes things even more challenging, going out and eating in restaurants. My daughter, who's now 16 years old, also got diagnosed with another endocrine disorder called type 1 diabetes. This also continues to add to my stress, worrying about her health and her wellness. After I got diagnosed in November 1st, 1998, I vowed that I was going to live an unconventional life. I didn't want to get married, I didn't want to have kids, and I didn't want to burden others around me. I knew my mother was worried. I knew my mother was worried if I would meet somebody, how my life was going to be impacted. And I also didn't want to burden somebody else coming into my life. I wasn't even aware that I would be able to have children. I didn't know if I would be pregnant. I didn't know if I would be able to have a safe and healthy delivery. And I didn't know if the baby and I would be able to make it through. During my time with Addison's, the most difficult part is the lack of social support. Many doctors are unaware of Addison's disease and its impact on those patients around them. Many times I was misdiagnosed. Many times I was left alone. Many times my partner and my family has been left to advocate for me and speak for me and pray that I'm going to get the treatment that I need to survive in the hospital. During my time of diagnosis, I've had a lot of time to reflect. My goals are to advocate. I've been an advocate and a social justice diva for most of my life. I decided to live my life not only in an unconventional way, but to serve my story and use my story as a way to help others become aware of Addison's disease. I've worked with the medical community, I've worked with my school. Every transition in my life will trigger my Addison's. Every life transition, from those good vibes of starting school or those new journeys of moving or starting over or traveling, can also trigger my Addison's. I always feel that I'm just one step away from a crisis and need to be prepared at any time. My goal is to raise awareness for Addison's disease. Through advocacy work, we can help make sure that marginalized communities, as those with rare diseases, may be seen and be heard. Not talking about these rare diseases renders them invisible. My goal is that money will be put into research in hopes that others may have more options and access to different medications, as well as different testing processes. At the moment, living with Addison's, we often have to self-medicate. We have to guess our doses. We have to guess our stress levels. It's a moving target. We are not aware of the medication that we need at the time that we need it. We are often criticized for overdosing. We are often chastised for not taking enough. It's a slippery slope and a moving target. We need support. I'm proud to be rare.